Good evening and thank you for watching News 12. I'm Rich Barabi.
I'm Macy Eglund. Governor Cuomo continues to bring in heavy hitters to reimagine New York.
Probably the best mind in this country, if not on the globe, to do this is, I believe, a true visionary, especially in the field of technology.
Now, the state working to build up a list of big-name talent to climb out of this pandemic. The latest addition is well-known business leader and former CEO of Google, Eric Schmidt. He joins other innovators, Bill and Melinda Gates, who will work to reimagine education, and Mike Bloomberg, who is working to launch the contact tracing push. That push comes as an alarming number of people here in our area are still getting sick. 11% of all new coronavirus hospitalizations in the state come from Westchester and Rockland. And the major question tonight is, how are people still contracting the virus?
With everything we've done, closed schools, closed businesses, everybody shelter at home, all the precautions about wear a mask, wear gloves, etc., you still have 600 new cases that walked in the door yesterday.
Governor Cuomo says 66% of those patients were at home when they contracted the virus. According to new data from hospitals, a majority of patients are over 51 years old and are not essential workers.
Well, one day after nursing home deaths jumped by nearly 2,000 in 24 hours, Republicans in the state Senate and Assembly are demanding answers. New York senators are calling for an independent investigation into state-regulated nursing homes and for an immediate policy change to create regionally based specialty long-term care facilities for COVID-19 nursing home residents. While Assemblyman Colin Schmidt is now calling on the feds to step in and investigate. In a letter sent to the Department of Health and Human Services, the Assemblyman wrote, quote, "We must know if New York State's mandate that nursing homes take COVID-19 positive patients resulted in more deaths. We must also know if New York State or other government entities' practices, protocols, and requirements increase the spread of COVID-19 through these facilities, resulting in increased deaths."
Well, it's been 2 months since visitors were banned from nursing homes and long-term care facilities. And while the move is meant to protect the vulnerable population, one family believes the isolation is doing its own damage. News 12's Beth Cefalu begins our team coverage tonight with that story.
We've had a great marriage with 3 great children.
For 64 years, Warren Kurzrock and his wife Sandra were inseparable.
Very loving and very good.
Then 2 years ago, dementia set in, and in January, Sandra had to be moved to Willow Gardens nursing home in New Rochelle.
I was visiting twice a week, holding hands and smiling a lot.
In March, the visits were cut short by the state restricting visitors from nursing homes because of COVID-19, and this husband knows their time together is running out.
She remembers me, but I'm not sure she remembers me the way we used to be, certainly. That's what worries me.
On top of visitors banned, group activities and nursing facilities have also been canceled to keep residents safely separated.
Residents are very isolated. They're not in group dining situations. She doesn't have nearly the amount of social activity as we had hoped she would have.
The family, now afraid every minute alone, is accelerating the Alzheimer's, eating away at what's left of Sandra's memories.
When we see her on FaceTime, it's very hard to get her to smile or to talk.
Luckily for Warren, management let him visit, separated by glass doors.
I could see her from the lobby more than 6 feet away, and that was it.
At 91, Warren still works nearly 7 days a week, but it's not enough to distract him from their time apart.
I found an old copy of our wedding album. I mean, that was not a lot of fun looking at it.
Made even harder with Mother's Day and Sandra's 89th birthday approaching.
It's not a lot of fun.
With the clock ticking,
I'm trying to get closer to her quickly.
a family now hoping for a miracle
Gotta keep going.
to spend their final days together
We miss her.
instead of ending 64 years of marriage 6 feet apart. Beth Cefalu, News 12.
Westchester health officials hoping to calm fears tonight about going to an emergency room during the pandemic.
If you have chest pain or you're short of breath or you have the need to come to a hospital, it is absolutely safe.
Dr. Renee Garrick of Westchester Medical Center says the hospital has always been safe for patients who are suffering from non-COVID-19 emergencies. During a Facebook Live discussion with Deputy County Executive Ken Jenkins, Dr. Garrick says it's important to seek medical help if you think you need it. The hospital is also open for antibody testing, which 28,000 people have already taken advantage of. Mount Vernon Mayor Sean Patterson Howard announcing she has tested positive for coronavirus antibodies. She shared the news on Facebook saying she's fine and hasn't had any symptoms. She urges everyone to get tested at doctors' offices or urgent care facilities. We continue to try to get the answers you need about the coronavirus. Tonight's guest on our special show is State Senator James Skoufis. Now, he is recovering from the coronavirus, and we'll discuss what his experience has been like, along with the latest measures his district is taking to fight the virus. You can send us your questions on our Facebook page. The program begins at 7.
Well, today is National Nurses Day. It's a day to celebrate the heroes on the front lines of the coronavirus pandemic. Instead of pizzas and thank yous, nurses at one Westchester hospital are calling for action on a bill they say would save more lives. News 12's Michelle Brown explains.
It's National Nurses Day, but at Westchester Medical Center in Valhalla, there'll be no celebration by nurses this year.
This year it's with a heavy heart and it's quite somber.
The coronavirus pandemic taking an emotional toll on some nurses at the hospital who have treated countless patients who fell victim to the disease. Corrine Noonan of Mayopac was on the original COVID unit that opened at Westchester Medical Center.
It was scary in the beginning because a lot of it, we weren't sure of what was happening, and the rate that people were decompensating, it was rather rapid.
People have been sending food to nurses all over, including those here at Westchester Medical Center, thanking them for their hard work during the pandemic. Now, while they appreciate the food, some nurses say there is really one gift that would make their day. It's a piece of legislation called the Safe Staffing and Quality Care Act. It would set nurse-to-patient ratios in New York healthcare facilities. The bill has been around for years. State Senator Shelley Mayer is a big supporter of nurses and is one of the sponsors of the legislation.
It takes a lot of momentum for something of this magnitude. Perhaps what's happening now is the push it needs to get over the final line.
For Corrine Noonan, who's been a nurse for over 30 years, the passage of the bill this year would be the greatest thank you of all.
This would really help us.
In Valhalla, Michelle Brown, News 12.
Well, nurses and other healthcare workers at Westchester Medical Center will hold a candlelight vigil tonight to support those currently on the front lines and remember all those who have lost their lives to COVID-19.
A grassroots organization launched during the coronavirus pandemic is helping to keep the undocumented community fed. News 12's Nadia Galindo continues our team coverage with the tremendous need that is silently being filled.
Myra Perez made 2 trips to the White Plains Hospital when she recently came down with coronavirus. She says, I had a hard time with this illness. It's a sickness that is really strong and painful. I didn't know if I was going to make it. The Port Chester woman says many undocumented immigrants in the Hudson Valley are getting sick. What's worse, they are also unemployed because of the pandemic. She says they need economic help more than anything. Many people can't make rent because they are out of work. After overcoming her illness, she decided to volunteer with Hudson Valley Solidarity and Hope, a grassroots organization of about 30 volunteers delivering meals to more than 200 undocumented families.
We have a list of the more vulnerable families, especially the families who are sick.
Immigration advocate Luis Yumbla says the meals are cooked by immigrant families or donated by local restaurants. Every bit helps, as undocumented families did not receive stimulus checks from the federal government, nor do they qualify for unemployment benefits, although a majority of them are now out of work and looking at the possibility of ending up on the streets.
As you see, the people who was impacted is that they giving the time and giving the support.
Volunteers like Sandra Fernandez, who lost her 51-year-old husband to COVID-19. She says this group helped me so much with support and food because I was quarantined.
It's too hard for her. She mentioned that she know what other families are suffering. She know exactly the pain that they feel, and she don't want to feel the other families feel alone.
Nadia Galindo, News 12.
So many people losing so many incredible lives. All right, let's talk about your forecast here. Let's switch gears. Let's get over to meteorologist Steve Teeling. A little gray out there again today, Steve, but tomorrow looks a little nicer, so I guess we have that to look forward to. Sunny at least.
Oh, we do. Tomorrow's going to be a great day, as a matter of fact, Macy, especially when you compare it to today. It was gray, it was damp, and just on the cold side for this time of year. Check out Thunderbolt 12 out and about the region, out and about the valley across our area today. Looking good out there, just waiting for some weather to report on, but nonetheless, not much happening out there other than a little bit of rain. We'll check our radar in a moment. All right, take a look at our breath of fresh air photo for tonight. This is from Brooke Weeks, and this was obviously Sleepy Hollow. What a beautiful picture. Look how calm that water is, the blue up above and, you know, interspersed with the clouds. Just really a pretty picture. If you'd like to send us one of your photos, whether it's nature, weather, anything that you might think everybody would like to see, we'll try and get it on air for you. You can contact me here at news12.com. Just send it to News 12, or contact me on my Facebook page, any of my social media accounts, and we will see if we can get your picture on air. Temperatures right now are chilly, if not downright cold for this time of year. 49 in Mamaroneck, 49 in Vista. We have upper 40s coming in from the Nanuet area, a little bit better up in New Paltz at 56, and we're looking at low 50s Beacon and Vales Gate as we speak. Again, a little bit of some light rain is falling across parts of our region. Other parts are seeing just cloudy skies out there, but this storm is going to depart off to our south and then eventually out to sea as we go on through this evening, and better weather on the way tomorrow. We'll be back with more in a couple of minutes.
Northwell Health thanks all of our medical professionals on the front line. Share your thanks by using the hashtag HealthcareHeroes.
Doctors discover a new treatment for the most seriously ill patients battling COVID-19.
We can't properly lay her to rest right now.
Plus, allegations of neglect at a local nursing home.
We were always with them, and we will continue to always be with your families and fight hard for safety for all of our patients, because those are our families too.
And we remember the work our local healthcare workers are doing to battle this deadly virus. News 12 starts now. Good evening, everyone. Thanks for watching News 12. I'm Scott McGee.
And I'm Gianna Gelosi. Governor Cuomo says as the state reopens, the most essential jobs with the lowest risk of spreading the virus will go back to work first.
Construction jobs, because construction jobs, especially exterior construction jobs, workers are basically socially distanced by the nature of the work and can wear masks, getting that construction industry up and running again. Manufacturing, in a manufacturing setting where you can do social distancing.
As the nation looks to reopen, the death toll continues to climb in other states as well as New York.
One of the most stubborn situations and the most distressing are the number of deaths. I think we're going to find, when all is said and done, that the numbers are much different than we actually thought they were.
The governor says the virus may have arrived weeks earlier than previously thought. He also says most COVID-19 patients coming into New York hospitals are not working and are not traveling daily. A major warning for parents during this COVID-19 crisis. The New York Health Department issuing an advisory about a serious inflammatory disease affecting kids in our state that's likely linked to the coronavirus. The condition is called pediatric multi-symptom inflammatory syndrome associated with COVID-19. As of yesterday, there were 64 potential cases here in New York. The health commissioner says in some cases, a dangerous inflammatory syndrome can develop. That can include persistent fever, abdominal symptoms, rash, and even cardiovascular symptoms requiring intensive care.
And now an update from the original epicenter of COVID-19, New Rochelle. Mayor Nolan Bramson breaking down in a blog post the where and why coronavirus is hitting the hardest. It turns out that since mid-March, the highest concentration of cases are in the central and southern parts of New Rochelle, with more than 90% of active cases in the 10805 and 10801 zip codes. Bramson says that's because those areas tend to be overcrowded with residents who face language barriers or are essential workers with pre-existing health conditions. Now, one day after saying that the COVID-19 task force would be winding down, President Trump now says it will continue.
We'll be adding some people to the task force, and there'll be more in the neighborhood probably of opening our country up, because our country has to get open again, and the people want it to be open, but we have to open it up safely.
Now, the president says this task force, headed by Vice President Mike Pence, has done a, quote, fantastic job. He says ventilators, face masks, gloves, gowns, now plentiful. And because of this success, the task force will now shift its focus to rebooting the economy.
Nursing homes across the state coming under intense scrutiny over rising coronavirus death tolls. And there are new allegations tonight about a local facility. News 12's Samantha Crawford has more.
We can't properly layer to rest right now.
Christopher Lena of Mayapack joins the thousands of New Yorkers who've lost someone due to COVID-19. He says his 91-year-old grandmother Lorraine succumbed to the virus in early April at an area hospital, days after leaving her nursing home.
My grandmother was in the Paramount at Somers. The end of March, she started complaining about symptoms such as shortness of breath. She had some minor body aches.
He says his grandmother reported feeling sick for about a week.
Never tested her for COVID.
Did they explain why they didn't test her? Were they unable to?
They barely talked to us about anything.
When asked if a symptomatic patient would ever not be tested, a nurse assistant at the facility who wished to remain anonymous said,
"There was a time when we didn't have any tests and people weren't being tested. It was actually quite sickening."
The administration of Paramount at Somers told News 12 our 300-bed facility is actively treating 27 patients in-house that have confirmed positive for COVID-19. The New York State Department of Health and our local regulatory agencies have been an excellent partner of ours throughout this pandemic. News 12 has heard stories like this from all over. It's lit a fire under state Senate Republicans who Wednesday requested an independent federal investigation into COVID-19 related deaths and lack of reporting in New York State nursing homes.
Do you have to pass in the nursing home to be a confirmed death? Do you have to be tested there?
And these lagging questions. For News 12, I'm Samantha Crawford.
And we reached out to the Paramount in regards to the nurse's claim about a lack of tests, but so far we haven't heard anything back.
All right, now to Dutchess County, where a two-day vigil will mourn the inmates who have already died from coronavirus. That vigil at the Fishkill Correctional Facility Thursday and Friday next to the prison's burial grounds. Advocates say the facility one of the hardest hit prisons in the state. They're also calling on Governor Cuomo to immediately release inmates most at risk of dying from coronavirus. Well, more than 1,100 lives have been lost in Westchester alone to COVID-19, and they are being remembered now with ribbons of remembrance at the Lenore Preserve. Inside a birdhouse that you can see here, there are purple ribbons and markers, so you can write the name of someone you lost to COVID-19 on one of those ribbons and then tie it to a nearby tree or roster. It's a way to show those who died. They are more than just a statistic. They are actually human beings. The county hopes to set up a more permanent memorial by winter.
With antibody tests becoming more readily available, how do you know if you should go and get one?
If somebody tested positive for the virus, we already know you have antibodies. The people who require the antibody test are really those folks who already had symptoms, but either tested negative or were simply not tested at all.
Now, antibody tests involve taking a blood sample. Results take 1 to 2 days to come back to you. And even if you do test positive for the antibodies, doctors say you should still wear a mask and practice social distancing to protect yourself and others.
Well, now a sign of support for our local heroes on the front line. News 12's Nikita Ramos has that story.
Fighting on the front line, we shall not be moved.
National Nurses Day.
We shall not be moved.
A day to honor.
It's been unprecedented in my 20-year career as a nurse.
A day to reflect.
We want to remember those that we've lost today, both our nurses and also all of our patients.
The New York State Nurses Association organizing a candlelight vigil at Westchester Medical Center Wednesday night, recognizing our heroes who put their lives on the line day in and day out during a vicious pandemic.
Although maybe you weren't the one that got to hold that patient's hand in the last minutes, but that person was never alone, that we were always with them. And we will continue to always be with your families and fight hard for safety for all of our patients, because those are our families too.
And on this day, Congressman Sean Patrick Maloney is introducing the Frontline Heroes Appreciation Act, providing New York's healthcare essential workers on the front lines with federal income tax relief. Also, healthcare workers making less than $100,000 a year will receive a $7,500 tax credit, and there is a tax exemption on those making less than $100,000 earned during this pandemic. In a statement, Congressman Maloney says in part, Hudson Valley's healthcare professionals and essential workers are fighting this pandemic every hour of every day. It's one more way for us to honor those who are saving lives and putting their own on the line. On Thursday at 4:30, Congressman Maloney will be hosting a press conference with state and local workers to talk about the work that they've been doing during this pandemic. He's also going to be discussing federal funding for state and local governments for the next coronavirus legislative package. In Valhalla, Nikita Ramos, News 12.
Well, healthcare workers in Yonkers also honored tonight. Yonkers Police and Empress Emergency Medical Services saluting those workers at Elizabeth Seton Children's who were in today's edition of the New York Post. They thank them for their diligence and self-sacrifice during this pandemic, and we certainly thank them ourselves.
A Mount Vernon teacher is quite literally going the extra mile to see her students. Pre-K teacher Helen Sarah Murray is going door to door to bring her classroom to her kids, spending her day reading, singing, and dancing with them like they used to do before coronavirus closed the schools. The interaction, even from 6 feet away, keeps the kids more engaged than just learning online alone.
They're having that time with me. We can catch up and they can get that interactive piece of learning that they're missing now when doing it all online.
Murray says the foundation of preschool is social emotional learning, and this one-on-one time fosters that growth as the kids get ready for kindergarten.
All right, let's talk about that forecast. Meteorologist Steve Teeling here with a little bit of good news in our at least short-term hyperlocal forecast. Right, Steve?
Yeah, absolutely, Scott. We have a great day headed our way for tomorrow. More on that in just a moment. But yes, something to look forward to brighten our days, because we're going to see a lot of bright sunshine tomorrow. Now, tomorrow, obviously, with the sun, there's going to be a lack of a chance of rain, shall we say. So a dry day tomorrow. Friday, rain is going to be developing during the afternoon, continuing to Friday night before it ends by Saturday morning. However, it may end as some snow, believe it or not. Wet flakes for some of us. Maybe in the high terrain up to the northern part of the Hudson Valley, there could be a little bit of a coating in some of the higher terrain there. Saturday and Sunday right now does look dry, but boy, oh boy, is it going to be cold on Saturday. We'll highlight all the details of that weekend forecast on your 7-day a little bit later on. Let's concentrate on tonight. Clearing skies, rain's pretty much done with. Cool temperatures, 40 the low in Yorktown Heights, West Nyack about 41. We're looking at 38 in Goshen and upper 30s Lloyd into the Mahopac area. For Thursday, as I mentioned, a 2 thumbs up kind of a day, mostly sunny, milder. We are going to be seeing highs generally in the low to mid 60s, and that's pretty much where we should be this time of year. Northwest wind at 10 to 15 miles an hour. Sunset is almost at 8 at night. So yeah, it's getting later and later, those sunsets for sure. Friday, we already talked about the rain developing later in the afternoon, continuing to Friday night, probably ending as some wet snow. And Saturday is just going to be a windy, cold day with wind chills in the 30s. Definitely feeling more like March than May. All right, when we come back, we will talk about your hyperlocal 7-day forecast. That's something you're going to want to see, because we do have some changes headed our way. That is coming up in just a couple of minutes.